Well, we've been chatting for a little while, so I'm a little extra pumped up right now. But I thought, let me go ahead and hit record so we can get this started officially. So I'd like to introduce our guest for this episode, Vanessa. Welcome to the podcast. How are you?
Hi, so nice to be here with you, Dr. Huntley. It's an honor. My name is Vanessa Guzman, and I couldn't be in a better place this morning. So thanks for having me.
Well, I'm very happy to have you here. So we've been, like I said, chatting for a little while, and this is what I love about guests on the podcast. And I know my longtime listeners are like, "You say this all the time," but I mean it. If this part ever gets old, I think I'll just stop podcasting. But I love to meet new folks and learn about what you do and your journey, and then be able to share that, on this podcast with our listeners. So I've gotten to know you a little bit, and I'm excited to kind of guide the conversation as we kind of go into your journey. So let's start with you telling everyone a little bit about yourself, just kind of a summary, and then we'll go into my more formal guidance
Ooh,
here.
okay, I love it. I love it. Well, Vanessa Guzman, I am a biomedical engineer by training. I am the daughter of two immigrants, Dominican immigrants. I have a family that is growing. I have twins in my belly as we speak, and a wonderful daughter, husband, and two dogs at home. And our focus at SmartRise, I'm the CEO at SmartRise Health, is to help organizations align their core competencies with the needs and complexities of healthcare, specifically in the areas of health equity, as well as value based care and quality. So, my trajectory really has led me to your podcast, Dr. Huntley, with the purpose of sharing any form of wisdom, but also from learning from the conversation so that folks at home, at their jobs, their commute, can hear a little bit about how can their day be different, or how can they make the days of who they're serving different as part of their day-to-day roles.
Wonderful. Really excited about that, about what you do. I think already you've touched on the heartstrings of a lot of our listeners. And really part of me just wants to jump in and go forward into that direction of that. But I always have to come back. Let's roll back a little bit and just review the journey of how you got here. I think there's a lot to learn there, and it's a great way to a lot of insights, things that we can articulate now that we maybe couldn't have on the path.
Yeah.
And I love the sort of the fact that it's not a public, using air quotes, public health degree, but you're absolutely doing public health work. So you mentioned biomedical engineering, but at what point did you first learn about or become interested in or even consider public health?
Yeah, it's such a beautiful journey because it wasn't linear. It was not planned, like most things, most of the best things in life, I think.
Right.
So when I went to Colombia, I remember heading there with, actually I had plans of becoming a computer scientist or a computer engineer. I love R&D type of work and working with data. And then I learned that quickly I wanted to socialize and connect with people. So from a at least training perspective, it became clear that being the person behind the scenes all the time wasn't something I that would serve me. So I switched careers by year two, and biomedical engineer had the perfect triad of science and systems and computer background that was really connected to my superpower, which is really connecting the dots. And I considered doing pre-med. Being a doctor, I deferred 3 years consecutively because I really wanted the firsthand experience of working with patients. And then I thought to myself, what is really my purpose? And my purpose was to heal for sure, but at a more system wide level. So it was a really hard decision for me to make. But in all honesty, creating the space to think that through helped me reach the potential that I now am serving. And it demonstrates because, even with my family roots, it became clear that everything my parents taught me, to the point of like how they lived, why they came to the United States as immigrants, the struggles they had in healthcare still. I'm the main caregiver for both of them. As they're older, they only speak Spanish, and their struggles, the real struggles there. And being first generation in the United States, it became a mission, still is, of becoming the person that they intended for me to be by coming here. And I am living that experience, and all those things. I think my lived experience, my training, then working at Montefiore Health System for almost 10 years really kind of combined the essence of who I am today, but also learning that this was the place I needed to be and the community is who I needed to serve.
I love that, and that sort of that self discovery is a theme.
Absolutely.
This road to into public health, and especially for the folks that I'm really drawn to and connected with that are really focused on this big impact. And really thinking outside the box, being creative, and just kind of how can I serve in this really big way, something that's a little bigger than me.
It's always a little bit bigger than us, that's the
Yeah.
beauty of it. But finding yourself that you are, doesn't matter what your title is, knowing that you have such authority and power over mastering that plan and influencing that plan. I think that was the tipping point for me, that I'm like, I could do this, especially as an
Yes.
entrepreneur.
That's awesome. So my next question is kind of a kind of easy to transition into. Is there a particular population or condition or public health problem that you are most passionate about now?
Yeah, there's two in particular. As part of our work at SmartRise, there was a lot of resources, and obviously the revenue has helped us understand the evidence behind the populations that really need the most help and understanding the disparities and root causes. And because now we're almost 4 years successful into the work, we've created almost a sister company called Ella Es, which means in Spanish, she is, and is a platform specifically dedicated toward the mission of improving women's health. So that population is of extreme importance. Why? Because it's a misunderstood community, is a very powerful population that carries generations across. I mean, we have the power to birth little people, and we master such a nurturing role in society that is worth dedicating our time and work and influence and expertise to improve what that looks like, and designed by women who have that lived experience. That's the first one. And then the second one comes naturally to me, is its caregiver support, especially for those underserved communities, caring for children as well as the aging population. I fit into both. I'm in that sandwich generation at the moment, with young kids and older parents. And childcare is very expensive, and it forces you to make very instinctive decisions that perhaps don't align with your core values, because you are kind of stuck between two hard places. And then you are also in a position of, how do I care for my older generations and still connected to my roots, when you're basically living in this world of duality, right? Where you have that culture that perhaps you left behind so that you can see improvements in your own life. But managing all of that is tricky, right? And as a woman of color, it's even trickier, because now we're talking from understanding different cultures to speaking different languages to really going to a place of servitude, to understand what are the needs of my parents, what are the needs of my children, what are my needs as a woman, and trying to meet that and harmonize that is extremely difficult. So those are the kind of behind the scenes, the reasons why myself and the team, obviously, who's amazing, have dedicated so much of this year toward designing what that looks like for 2024.
Yes, that's so important to have clarity around, because it is the thing that gets you up every day, keeps you going when it's tough. And for everybody whether you're doing this on the solopreneur route or just the individual assigned to tasks, or if it's a team, it's important to have the clarity around what really matters to you.
Yeah.
What is getting you, without, it can't be the paycheck, but however good or whatever, regardless of the amount,
Right.
it has to be something else. It has to be something that you really are connected to.
Right. I agree wholeheartedly with that, because if it's not connected to a purpose or a passion or that thing that wakes you up, it becomes that thing that's not sustainable, right? How can you
Hmm.
do something for so many hours during the day doesn't serve you, is not connected to a bigger purpose? There's definitely going to be some gaps, whether we want to see it or not.
Right. Yeah. That's very well said. You've mentioned your organization, High and then you kind of touched on the second one.
Mm-hmm.
So why don't you take some time and explain that a little bit more fully? Who do you serve? Describe the organization, the company, service products, and just tell us, dive into that.
Yeah, so I'll start with SmartRise Health. SmartRise Health is a consulting firm that's focused on care redesign, from everything from workflows to identifying and implementing the infrastructure that you all need to be successful in meeting health equity, quality goals, value-based care, payment, because ultimately the doctors, everyone needs to get paid, right? To move the
Right.
needle in this industry. So we do perform, just as examples, many of the health equity and joint commission accreditation and certifications for organizations so that they're positioned to be more credible in that specific area. But within those certifications, we also help them meet like what is most relevant to them based on the disparities that we learn they have, and how do we use that data to inform and apply the different interventions, right, for lack of a better word, interventions and programs that are relevant to those specific populations, whether it's BIPOC, LGBTQ, underserved communities, right, whatever delta we find between the most advantaged and disadvantaged population, we help fill the gap so that all populations rise when it comes to improvement in quality of care and quality of life. So that's SmartRise in a snapshot. And we work with everyone from accountable care organizations, provider groups, payers, pharma companies, other manufacturers, and community-based organizations, of course. So SmartRise is, again, 4 years in. Secondary to that, but now primary focus for me personally, is HIS Health, which is an organization dedicated to serving women in the full extent of the definition, whether it is, sex at birth or gender identity over time, trans as impacted. And we work with organizations to implement wraparound services. So we work with, let's say, provider groups who have perhaps existing programs, who have OBGYN or primary care, but we add other layers such as cultural competency, health literacy, special programs dedicated toward like things like menopause or other GYN related conditions that impact women specifically, or more so women in different ways, right, than the rest of the population. And that is so close to my heart because the reason we created that company is because prior to the family that I previously described having, it was a journey for my husband and I to have children. We had 3 miscarriages in 2020. And every time I go back to that conversation, it doesn't get easier explaining it because we still don't know why those events happened. But I do understand that with our background, we did need to do something, because if that was happening to us who are very, health literate and in the healthcare industry with, seeing probably the best doctors we could at the time, it was still very hard to navigate the system. I still had to see like 50 doctors, I'm not making up the number, 50 doctors approximately in the matter of a year and a half. And it was the first time that I self-discovered and really understood like the importance of my body and understanding my body and honoring my body. And as a woman, you shouldn't be discovering those things when you're 36 years old, right? You should be
Right.
thinking about those things the minute you have enough consciousness to understand how special you were designed to be. And we wanted to create HIS for that reason, so that we can engage populations at a very, very early stage and really almost create pathways. Just like when you're pregnant, for those who have gone through this journey, you know that every step along the way, in the first, second, and third trimester, there are very specific things you need to do. And the doctors tell you what they do. But that's not healthcare across. Like, not all of us choose to be mothers, and not all of us are in our childbearing years. So what do you do the rest of your life? So HIS is
Yes.
dedicated to cross-cutting that pathway for.
That's really interesting. I paused to think about that. First of all, I'm so sorry to hear of that's three. That's so much in one year. And my heart goes out to you. But I also admire your courage to share that and to also then turn that energy into something that, okay, you know what? Something needs to be done. And that does take a lot of courage. And I admire that. And I love, now I get the name. So in my broken Spanish, and I look at the name, it's spelled, in Spanish, S, which is she
Yeah,
is translated. I remember that much.
yeah,
And that's just so much power. So in a moment, I'm just kind of like letting that settle in a little
yeah,
bit. So that's about a year or so that you started that
yeah,
specific
yeah.
focus. And tell me again, I know who it's for, but who are your clients? Are there individual women or you serve organizations then filter down to the individual women?
We start with our organizations who filter specific groups that are most vulnerable, especially those in
Okay.
urban settings or with federal public insurance, who tend to have the largest limitation when it comes to options about any
Hmm.
healthcare delivery. We don't just focus on maternal health, although that's so important and part of it, but we focus on preventive care early on, onset of adolescence, like from cervical cancer screening, mental health, to lifestyle, which is a big focus. So unlike other organizations in the space, we focus a lot on coaching you as an individual, and then healthcare, or you prioritizing health as a woman, becomes part of that coaching and care plan, versus the opposite. You have diabetes, you need to have to focus on diet and exercise. Usually that's how healthcare works. It's really targeted toward the outcome of health. For us, it's important to like, no, what do you want as a person? Are you going through career transitions? What's family planning? What's that look like? And then we create tailored pathways, essentially, like literally, over the next 10, 20 years of your life, depending on where you want to go. But we start first with organizations like employers, payers, health systems, and then the goal is over time have a B2C, specifically targeting or working directly with consumers when we have enough evidence generated to say, okay, we're ready to now engage directly the consumer.
Oh, that's a lot, and I applaud you for what you're doing and how you're leading. And like I said, you and I were chatting quite a bit before we started officially recording this interview, and I know we're going to be in touch for a long
Yes,
time.
we
I'm already thinking of some people that I want to introduce you to, and I just one that comes to mind. I've had her on the podcast before, so I'll make sure that I get her episode number and link, and I'll make sure I add it to the show notes. But
should.
she Summer is her name, and she founded a biotech organization. They basically are creating endometriosis diagnosis
Oh, that's
kits,
beautiful.
um,
That fits
and
right in.
it's an yes, it's just such a incredible story behind her journey, and she's overcoming all the obstacles in a battle that's in an industry that's not really led by
Right.
women. But I would love for you, the two of you, to meet. So that's why
Wonderful.
I'm thinking of her right away, sharing it real time on the podcast. But I will make sure that because I wasn't prepared for it, I will, as I put this together in the at the end of the episode, everyone listening, I'll make sure I have that episode number ready to share with everyone, and then
Connect.
with you, Vanessa, I'll make sure we get that for you
Oh,
connection there.
thank you.
Yeah, there'll be some more but she just popped on my mind
Yeah, it
right
connects so
around
well
that.
into our
Mhm.
resources and toolkit.
Yeah,
Yes.
great. So I am going to, speaking of connecting the dots, I'm going to shift just a little bit into just one question I'd like to ask you, just again, because of the way that your journey led you to public health. And then with the work that you're doing, again, I applaud you for how you're leading in both of these organizations. I want to connect public health and what you do. So my question is, how does the understanding of public health help you better serve your clients and community and have a greater impact?
It's so important because public health carries best practices, workflows, and the data that we really need to design effective, sustainable programs over time, right? Usually, our first step upon engaging any of our clients is an assessment of where are you right now? And in order to do that, you need data. I mean, as well intentioned as we all are, especially for those in health equity and promoting it, we tend to just throw resources and best practices, and we hire people, and it's never really clear, unless it's intentionally designed that way, to serve a specific population or a specific gap. So what winds up happening over time is that your intended aim becomes diluted by lack of focus or lack of imperatives, prioritization, or budgets. So we leverage public health as much as possible because it carries that weight. It also carries a lot of policy and advocacy that for us is very important. As we have the evidence and we work through your root causes of your client and the initiatives that we develop with you that show some form of ROI, not necessarily monetary, maybe quality of life or other essentials, then we are able to advocate for payment models later on that, as you well know, Dr. Huntley, are, in some areas non existent. A lot of this work is being done single handedly thanks to some revenue that we see in quality, right? Which is great because
Right.
you can't have equity without quality and vice versa. They're all kind of, I always see health equity as a subcomponent of good quality of care. You're just being much more tailored and intentional when you're talking about health equity. But yeah, I think policy, payment models, data, all essential components of public health that are must to, really carry out the work in care redesign effectively.
Yeah, that's really great. And I agree with you. I completely agree with you. And you really touched on so many. Sometimes in public health, we could be a little siloed with our advocacy groups over here, the epidemiologists over here, and the folks. So you really kind of broke that down really well, broke down those silos and really showed how holistically it's important, that understanding how it's helping you. I love that.
Thank you.
Okay, just a little bit more, and then I'll be able to let you go. So, our listeners of the podcast are a very diverse group. I mean, we've got students all the way up to senior career
Mhm.
professionals, and then we've got some entrepreneurs, and then we've got folks who are not traditionally in public health, but are very interested and curious and love hearing the conversations. So, just a mixture of folks. But thinking about that, is there any one bit of advice that you would share with someone listening who may be also interested in doing something similar to what you're doing?
Ah, I love it. I love that question because it really it helps. The answer will help you as an individual empower yourself, right? And it starts with you. I don't want anyone to think that this work is so complicated. It is complicated, but it's so complicated that you're unable to have an impact regardless of where you're sitting. If you're someone like a student or someone who's just beginning to understand public health and is interested in public health, learning is probably your biggest asset. Knowledge is power. Getting to know more of that and then connecting that knowledge to your purpose. And that requires time, right? And space for you to know, like, oh, I am passionate about the community and serving my community and volunteerism, or I'm interested in sharing knowledge. And like you, Dr. Huntley, you created this beautiful podcast platform because of not only your understanding what was the opportunity, but for your own self, it was clear that it was part of that purpose, that you wanted to use your platform to amplify something that was so meaningful. And that requires space and time. So I would say knowledge, seeking knowledge, if that's important, do that. For others in roles in specifically in healthcare, whether it's payers or health systems, it's more about how can I be much more targeted, tailored, intentional about the work that I am doing? How can I influence my circle of influence, right? Whether that is policymakers, quality stewards, maybe is your CFO, maybe is your team. For those who don't consider themselves in a purchasing position or a leader by traditional definition, is how can I think of my own biases or lack of inclusiveness in the workforce? And we can all do that. We all have biases, right?
Right.
But we need to first understand what they are and how can we remedy them? And how can I see in you, Dr. Huntley, value, regardless of your design, and honor that design? And that alone, if you do that across, we have a win.
Oh, that's really powerful. I love that. I absolutely love that. So many levels, because oftentimes people who have an idea or inspiration, or they will often, I used to do this, think, well, I'm not like so and so, or I don't have those resources, or I'm not that. So you think, it'll easily make you think, well, I can't do that yet. But no, I think if you have the inspiration, you have the idea, you have the desire, you can absolutely serve at any level. If you're a student, I used to say this all the time on podcast episodes
Yeah,
too. You could be the very first semester of your, brand new PhD or public health program to whatever level, but the very first beginning, and you're still going to be ahead of someone who doesn't have that expertise. So you're always in a position to help, to serve, to share in some way. Spread your wings, take some action,
right.
feel that power to still have that impact, regardless of where you are on that spectrum of beginner to more senior.
Absolutely. And mentors. I mean, as much as my I describe what my journey was, one thing I have not mentioned is give merit to the people who opened the doors for me, who trusted work,
Yeah.
effort, words that would come out of my mouth to do the work that I'm doing today. I'm very grateful. There's been at least a handful of people who trusted me. So if you have nothing else, is how can I demonstrate that I trust a person? Because that alone will inspire another person to do their best. and to act at their highest potential, with that, whatever that means to that person. And that is the essence of equity: is value, is wisdom, and is acknowledgement of a sense that we all belong to a much bigger and master plan beyond sometimes on our understanding.
Yeah. Oh, that's so wonderful. Value. What was the second thing you said?
Value, I forget what I said, but value certainly is one of them. Oh, wisdom.
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 Okay. I couldn't read my
So
notes. I was trying to write it fast.
understanding is key. A sense of belonging and acknowledgement,
Okay.
I think, is they're all so important.
Yeah. Thank you so much. This has been such a great conversation, which I knew it would be. I know my listeners are enjoy our audience is listening and agreeing with me. Thank you for sharing so generously throughout this conversation on this episode. We will provide links to your sites and connection so that people can follow up with you. But just, really briefly, what is the best way for people to connect with you?
I am often on social media, specifically on LinkedIn, so you can find us there. You can also visit our
Okay.
websites, smartrisehealth.com or ajishealth.com, or via email. So all listed there. But more importantly, I think of us as a resource of knowledge, of questions, another toolkit that you can add to your world to really empower you. So I'm grateful that you have us here and invited us to join you today.
Thank you so much. And I am going to share with you all in the show about how to find the show notes and the links and all of that in just a moment. But yes, I appreciate you for being here, Vanessa. Thank you so
Thank
much.
you, and have a wonderful day to all of your audience. It's been wonderful to be here today.